Welcome and thanks for joining us at Trump, Oz, and You, how technology can help you compete in an ever-changing world. Our hope today is we've brought together a pretty interesting panel, and what we'd like to do is maybe talk past some of the headlines and the sort of sensationalist conversation around the new administration, and really focus on how are the changes that we expect to happen going to ripple into our part of the business, right? Which is connecting the right person with the right policy at the right time through the right agent. So I've got a really amazing panel that I would like them to introduce themselves, starting with Professor Michaela Lavender.
Hello, I'm Michaela Lavender. I'm a health economist at the University of Nevada, Las Vegas, and a lot of my research is on policy related to the Affordable Care Act, Medicaid expansion, Marketplace, and Medicare, and how that affects individuals' decisions for insurance. And I also teach, and part of my class on health economics is about health insurance literacy. And so it's so important, that broker relationship of trying to explain this material to people. So I've just loved being here and hearing from all the industry side.
Excellent. And then Christy?
Hi, I'm Kristen Hopkin Bishop, and I am a second-generation Chief Operating Officer at the Brokerage Inc. We are, oh, thank you. I appreciate that. We are one of the largest independently family-owned and run operations in the country, and we have about 25,000 insurance agents across the country. And we are here to represent kind of the distribution side of this discussion today. So I'm very excited to be here.
Terrific. And Susanna?
Hi, I'm Susanna Roberts. I'm the CEO for Sonder Health Plans. Sonder is a local Medicare Advantage plan based in Georgia only. We actually are the only local Medicare Advantage plan based in Georgia. We've had some really great success this past AP. We actually went from 3,500 members to 20,000. So we're very excited. Woo! So I'm here to represent the MA side.
Excellent. Thank you so much. And I am Brendan McLaughlin. I'm the president of E123. A lot of you know us from this conference and from others. We are a software company, a technology company that focuses on strategic revenue management. So it's all the things that a health plan, a carrier, an FMO needs to do to drive profitable, reliable growth in their business. Things like commissions and agent portal and enrollment and agent onboarding and those kinds of things. And in doing that, in being involved in that side of the world, or that side of the industry, we see how changes in policy, changes in the competitive environment can really tax the distribution system. Right? When we say there's going to be more competition in healthcare, that's exciting. But what that means is, while there's going to be more opportunities to win, there's also going to be threats. And there's going to be difficulties, and there's going to be opportunities to lose and to struggle. And those with the technology to compete are the ones that are going to be able to take advantage of these opportunities. So that's kind of what we're going to talk about today, are what do we see as the changes, the opportunities, maybe the threats that are coming down the pipe in really all different aspects of health insurance. So the first area where we want to focus some attention is in, believe it or not, Medicaid. No one in this room probably sells Medicaid, but this is going to have a ripple effect that's going to impact everything everyone in this room does. And so we'll start with Professor Lavender to give us a view into what she sees as coming down the pipe in terms of changes to Medicaid.
Yeah, so I'm going to kind of talk about some of the policy basics, and they're going to talk about how it affects their businesses in a little bit more. But as he mentioned, within insurance markets, there's crossover, and there's people who could move between different types of insurance depending on what policies happen. And so one of the kind of bigger news headlines we've seen is that the House Republican budget outline wants to cut $880 billion over the next 10 years. And from the pool that they're trying to cut, they don't explicitly mention Medicaid, but that budget is 93% Medicaid once you don't consider Medicare. And so it really does mean pretty drastic cuts to Medicaid if that were to go through. Now, the Senate side seems a little bit more hesitant about those cuts, so maybe that would get scaled back. But the question is, how does that happen? Block grants, probably not the way that it's going to do, because as enrollment grows over time, it'd be major cuts, and that would not probably be feasible. But there has been a lot of talk about that ACA expansion group to young adults, which currently the federal government chips in 90%. If that were to go down to the standard federal matching rate per states, some states, about 12 of them, said they're just going to cut that expansion population. So what does that do to other markets like marketplace plans, right? Are some of those people going to be eligible for marketplace? Are we going to see a crossover there? That's an important question. Urban Institute recently came out with an analysis of what that change to the FMAP would do, and it's around 570 billion over 10 years, so not quite enough. And so that kind of brings us to the next part, which might have a bigger impact if you're thinking about dual eligible populations that some of you might work with. And that's, there could be per enrollee caps on growth, so that the spending can only grow at market or medical inflation, and then that would over time reduce the expenditures per an enrollee, right? And that would affect not only the expansion group, but also these dual eligible populations. And so that's gonna put a lot of pressure on state budgets and questions about where that funding would potentially come from. And so while this is Medicaid, right, it does have crossovers to our marketplace and our dual eligible populations that are really important.
So I think, obviously, DSNP being the biggest concern for MA plans, you mentioned the impact that that's going to have. So we already know that it's going to decrease the population of DSNP. We know that it's going to increase their out-of-pocket. So those people who used to be being able to get assistance for just additional drugs, et cetera, or lower copays, they're going to all be impacted. So we're going to see that. And then I think the other thing that from a plan, it's going to impact our plan design. So we spend many, many months kind of building and creating these plans that we can give to brokers and agents to sell and launch on the market. So that's going to have a huge impact when it comes to plan design for us.
Yeah, and at the brokerage we sell both Medicare and ACA under 65. So this is something that we are watching and keeping our eye on. We are fully prepared for some plan designs to look a little different. We will look for plans that maybe aren't fully dual Medicaid, Medicare plans. Maybe it's an LIS type plan or a chronic plan. So there's a lot of dual eligible beneficiaries out there that will still have options. It just might not look the same that like it does. I think on the ACA side, the affordability for the plans is something we're watching. How many subsidies do these clients have? I mean, there's so many. I don't even know the statistics of it, but a lot of clients have subsidies, and what does that mean? How does that if these cuts do go through, where do they go? What does that look like? And so it's definitely opens an opportunity for us and our distribution to get creative. And do we need to look at other plans, not just ACA, but are you looking at cross-selling and hospital indemnity plans and trying to really take care of the client, the consumer. Something that also we're worried about is it could potentially hurt if you're pregnant or if you are lower income earner, and the low income earners they're going to get hit the hardest. And that's something that we gotta, as agents in this room, we've got to be ready, and we've got to be able to go into a household and make sure that we're really taking care of them and looking at all their options with the health plans that are available to us to sell.
Well, and I think this brings out another good point. I think one of the things that I've seen, especially in the Georgia market where we are now, is there are state programs that I don't think everyone's aware of. I just found out about one that if you're a caregiver and you're taking care of someone, the state will actually pay you to do that, and you could still have a job as well. So I think really understanding what other assistance that they can get that's not directly correlated to ACA or Medicaid.
And that's our job, right, as agents, is to make sure that we are educated, that you're teamed up with the right FMO or the right upline to make sure that you're getting that education and making sure that we are taking care of the client and with all the resources that are available around the state or nationally.
Yep, and it strikes me that basically what we're seeing here is a giant disruption to the status quo of the marketplace, right? That suddenly millions of lives, and we can't even necessarily pinpoint who they're going to be or when, but we know millions of people will now no longer be eligible for Medicaid and will be looking elsewhere. And so from our standpoint as a technology provider, we're asking, how can we help the health plan and how can we help the FMO get the best information down to the agent where it matters? Because at the end of the day, agents build a book of business out of their neighbors and their friends and the kids on the soccer team and the people in their church. And if you folks can better educate them how to take care of their folks through the technology, that's going to be a winning combination. If the agent is out there saying, I don't even know what's going on, let alone what's right for you, that's going to be a real challenge. So I think this one factor we probably could have talked about for 50 minutes, but this is going to have ripple effects really throughout.